Good evening, everyone. Thank you for joining us for the live session of mindfulness with Dr. Richa Dhamija. As you know, here at Mindfulness, we attempt to break the stigma surrounding mental health. Today, October 10th, is World Mental Health Day, and the theme this year is Mental Health for All. As one of our previous guests on the show said, our mind is connected to our body. So if we can seek medical help when we have any physical ailment, then why can we not do the same for our mental health? As Dr. Dhamija had said in a previous interview, it is better to address the elephant in the room than to brush it under the carpet. Doctor, thank you so much for joining us today to answer everyone's questions on mental health. We will address as many questions as we can fit in this time span, but I will be making note of the remaining questions and sending them to Dr. Dhamija after the session, so I can get back to all of you with her replies. I now invite Dr. Dhamija to introduce herself.
Hello, everyone. I'm Dr. Richa Dhamija, and today we are here, to mark the Mental Health Day. And I would be very pleased to answer, all the questions regarding mental health or emotional issues that one is facing, and could be big or small. And I just feel that, that you find it it's your safe space to just feel free to go ahead and just have answered whatever you need to.
Yeah. Thank you, Doctor. So we'll begin by answering the questions that viewers have already sent in. And the rest of you can keep sending your questions in the chat box. They'll come to me privately, so I will read them out for Doctor. So Doctor, the first question that we have is, with children exposed to months on end of online school, on phones and laptops, do you think that there'll be any psychological setbacks when we actually have to go back to school in real life?
See, definitely change is stressful, not for everyone, but for people who are already dealing with some kind of issues, a change is a bit unsettling.
Yeah.
And this has been a drastic change. Whatever happened, nothing in our lives had prepared us for something like this, like the COVID situation, whatever happened. So it's really impacted the youngsters, adults, and the older ones, like pretty much everyone. We were never prepared to handle something like this. The kind of situation that's been for months actually.
Yeah.
So definitely there's going to be like a change. So for people who have, for example, let's say social anxiety, they will have they just have to get into the groove of it again. Earlier they were used to it, and they've been like people who've had a tendency to isolate themselves and be a recluse and everything. So it might be stressful for them to just get back.
Yeah.
And I'm sure the outgoing ones are just raring to get back.
Right, of course, yeah. So we actually just got our first question, Doctor. So Doctor, how do you think that families who suffer from, say, domestic violence or child abuse, how do you think that they are dealing with lockdown, and how can we help families in those situations?
I'm sorry, just repeat the whole question again.
So Doctor, a lot of households have abusive members and people are facing some sort of violence at home. Be it physical, mental, or however. So how do you think we can help people like that? And how do you think COVID is impacting those families?
So I think pre-COVID, we all had some kind of support system going or some escape mechanism going from situations at home. So usually the children who have any kind of dysfunction happening in terms of abuse. So what happens is it's a very stressful situation. Are we speaking only from the point of youngsters, right?
Yeah, mainly, yes.
Yeah. So youngsters who are dealing with abuse at home could be verbal, non-verbal. Sometimes just parents not speaking enough is abuse enough and stressful situation for the sensitive ones. So whenever we are dealing with any kind of abuse at home, physical, mental, emotional, sexual. And at COVID times, you're just totally bound at home. So you have no escape or a coping mechanism or a distraction mechanism functioning. So I think the crisis will really play out in maybe the worst manner in terms of some kind of outbreak, in terms of serious anxiety issue happening, a nervous breakdown happening, or a panic attack happening because it is just too stressful to manage, and somewhere this coping mechanism will give up.
Right.
Because children are not well equipped to handle, because they don't have experience on their side, and they're more young and innocent, and I mean they have less experience, so they don't have the maturity sometimes to handle it, and it just they have no answers to be in such a situation, and they're just like stuck in that situation.
Yeah.
So I encourage such kids to, like, at least share with their friends, seek help, or at least read and educate themselves.
Yeah. So, doctor, as a follow-up to that, so say someone reaches out to their friends, what can we as adolescents do to actually help our friends in need?
I think by making them, firstly, just by providing support.
Yeah.
We are not, so the best way of providing support would be, we should never be swayed by the whole situation. It's not like about shedding a tear with your friend and saying, so I think it's about empathy. Empathy is having your boundary, listening to that person. And if you don't have the, let's say you short of answering and taking care of such a situation, maybe enroll a supporting adult in your environment, and basically connect them and organize some kind of help to get to them, like some kind of professional help.
Yeah.
If it's not possible for because the permissions may be involved from their own parents, so at least some links can be sent about some tools like EFT and things like that. We could talk about that later.
Right, right. So
So
I can
whatever
link some
support
help.
we can manage, whatever guidance that we can manage, if we cannot do anything else, just by being there and listening is sometimes cathartic enough for the individual. And just to have, like, somebody, even one person, if you feel understood by amongst your friends, I think you can really deal with big crisis.
Yeah, agreed. Yeah. So if we're talking about families like that, even while being at home and surrounded by their family members, they might be feeling lonely. And how do you think that we can combat that loneliness without having anyone to talk to about it?
See, loneliness usually is a result of a much deeper issue where self-love is lacking. So
Right.
loneliness means you're not able to enjoy your own company. And by investing yourself, see, it's, of course, there's everything is in balance is good, right? So having friends and everything is good, but being over invested in friends and
Yeah.
feeling extremely lonely when you're by yourself. So
Yeah.
basically, I think they need to work on self-love.
Right. Right.
Does that
And do you
answer
have
it
any tips for
adequately?
that? Yeah, but do you have any tips for like that?
So self-love is firstly writing down your flaws, accepting yourself as who you are, because everybody has their flaws and good. So like, just accept your flaws, accept your good qualities, and keep on honing yourself to be a better person. And you can define yourself, that your self-love parameters yourself, and work towards being that the person that you can really enjoy being with,
Yeah.
and fall in love with yourself. I suggest, when we fall madly in love with ourselves and give ourselves, like, a lot
Right.
of importance, have great healthy boundaries, and have healthy relationship, well balanced relationship, like, with family. So somehow I feel making peace with parents is super important. If it's not possible on their own, then I think some supportive relative can be involved, maybe, or a
Yeah.
person who has a great rapport with parents already and can be like a channel, or like a mediator. And
Right.
so loneliness at home, I think that would be really sad. I mean, it should really be worked upon and really
Yeah.
addressed, because at home is where you feel like wholesome. And I really love recommending positive affirmations, like, I'm whole and complete within myself. To say something like that 21 times in the morning, 21 times at night, really can help you improve loneliness.
Yeah.
When you feel hope, when you say, I'm whole and complete within myself, the loneliness begins to go down.
Right.
And of course, hobbies really help.
Of course.
To tuning into your own passions, just always keep asking yourself, what is it that I love doing? What is it that I love doing? And once you figure that out, I think there'll be no lonely moments.
Agreed. Agreed. Thank you, doctor. So, doctor, can there be long-term psychological impacts on fear perceptions of students with respect to diseases and germs? Like, do you feel like this generation will have more germophobes than previous generations because of the fact that this pandemic has affected all of us so badly?
Absolutely. Definitely. I think, so a lot of people, young adolescents as well as adults, we're dealing with all the time that something is really triggered, the phobia is really triggered. There could be other emotional underlying issues, like, just generally less bandwidth to handle with crisis. And when this is something actually really stressful, this can really trigger like a lot of underlying stuff and like come out as exaggerated phobia, anxiety. We're constantly dealing with this right now. And so I think the best way would be to actually have educate yourself about the black and the white, because I totally believe that once the light of knowledge comes in, the fear and phobias melt away. So when you get correct information and not exaggerated information, and I think we just have to keep telling ourselves that we are, everybody in it is together. And phobias actually can be addressed through hypnotherapy very effectively.
Yeah,
Just by 2 to 3 sessions, even if it's like 10 on 10 phobia, it just begins to go down straight away by first session onwards.
right, right.
And of course, there's a very simple thing called EFT. Maybe we could organize like just a EFT workshop, which is like it's like, that involves really just tapping at few points, and whatever phobias, not just germophobia, any types of fear or phobias that come up, just by tapping at those points, you can reduce it. And sometimes it can be so exaggerated that it impacts the quality of your life, and it makes you very dysfunctional in your everyday life because you're so phobic and it's so stressful
Right,
being there.
right. So, doctor, can you explain what exactly EFT is?
EFT is emotional freedom technique, and it just involves like tapping in certain point. This is called like the karate chop point. So I'll just give you an example, and of course we can do a detailed something later.
Yeah,
So let's say, even though I'm feeling very phobic of all the germs, and it's very stressful for me, in your own words, very stressful for me, I still choose to heal and integrate that part of me. I still choose to heal and integrate that part of me. I still choose to heal and integrate that part of me. And 3 deep breaths. So 3 cycles of this. So this is
right.
EFT is like a full, like at least we could do like a 1 hour workshop or something like that. So
Yeah.
EFT, but it's all over the net. Even if you just to look it up yourself, you can look it up. Emotional freedom technique
Okay,
to
okay.
bring the phobia levels down. So from dysfunctional level, it'll become to manageable functional levels immediately.
Right.
So it'll not lead to at least a panic attack or something like that in a situation where they think they can't control the germs, and it's like it's really impacting their going out and doing important things.
Yeah. So, doctor, someone wants to know that can you share any particular difficult situations that you have managed to help using hypnotherapy, and how exactly does hypnotherapy work?
Okay. To understand how hypnotherapy works, it's important to understand what is conscious mind and subconscious mind first. So, conscious mind is like a smaller part of the brain, and subconscious mind is like a much larger part of the brain. Mind, sorry, not brain is the wrong word. So, what happens is when we're working in hypnotherapy, we are able to basically speak to your subconscious mind, where all the automated thoughts and deeper thoughts and patterns and belief systems are coming from. Let's say, for example, let's just stick to germophobia only because I think this is the thing
Yeah.
right now. So, for example, if a person comes to me and says, I'm very, very phobic of the germs. So, we use some relaxation techniques which involves reverse counting. So, basically, the intellectual mind becomes like in an altered state. It's not like really sleepy, but it takes a back seat, and the subconscious mind comes to the forefront. And basically, we ask the person that when is the first time that you ever felt this kind of stress?
Yeah.
So that will lead us to exactly the point where that person started becoming a fearful person or a stressed out person or an anxious person. What made them vulnerable to stress and anxiety or fear or phobias? So
Right.
once we reach that point, once we address the underlying issue, then we can just reason with the intellectual mind that I'm sorry, just repeat your question again. I'll just join that dot.
Yeah, so firstly, how exactly does hypnotherapy work? And are there any
Okay.
particular instances that you have seen that were very difficult to treat with normal therapy that hypnotherapy worked
Okay, so I'll stick to the germophobia
in?
first, and then go on to like a real example.
Yeah, right.
So for example, we take them into that subconscious space where they experience any kind of phobia, fear, or any stressful situation, and connect it to present day knowledge. So once you feel relief in the trigger, something that is really triggered for you, then once we reason with the intellectual mind, I think the dots join very logically, and some kind of aha moment comes, like, oh.
Yeah,
And once that understanding sinks in, the person feels immediate relief in the issue, whatever they're facing.
right, right.
And so, what I have recently handled is basically 11 on 10 anxiety. Somebody came, he's like, so 11 being like 10 on 10 being worse. So she said, like, it's 11 on 10. And so then, I mean, by progressive sessions, so it had physical symptoms like palpitations, like a very uncomfortable, queasy feeling in the gut, leading to vomiting, like real physical symptoms, that kind of that high level of anxiety. So by hypnotherapy, I think 5 to 6 sessions, it came down to 3, 4, and by the eighth session or something, it just became like half on 10, and it would just get diffused easily.
Yeah, yeah. Okay.
So we are able to drastic, so that person is able to confidently say, I'm just not anxious anymore, which is one of the difficult cases, to totally eliminate it, like, from the root.
Yeah. And so, what would you like to say to someone if they're scared of going under hypnosis? Because that is a very real fear that a lot of people have.
So what I say is, let's say if you're booking an online session, you could actually, in the sanctity of your own home, you can actually ask your sibling or somebody you trust to be around. I think that
Yeah,
should make you feel very safe.
right.
Or even when you're coming to the clinic to me, I would say you can bring your, like, some friend or somebody to just watch over you, that you're doing all right. That should make you feel very safe, I guess. Otherwise,
Yeah,
hypnotherapy is safe. I mean, I think right now, these days, we're very lucky, we can just research online. So hypnotherapy is a clinical tool which is being used, like, for many, many years in so many countries, and in the hands of the right clinician, it's really safe.
right,
People who've been trained to handle sensitive issues, it's safe.
right. So the next question that has been sent in is, what is OCD? Is there any treatment available? And if yes, how exactly does it work?
Okay. So, OCD, obsessive compulsive disorder, could mean actually any compulsion. It could be with cleanliness, it could be compulsive eating, it could be compulsive. Some people have that thing with symmetry and patterns and things like
Yeah,
that. They want everything organized symmetrically and things like that. So, on the surface, it may not seem like a huge problem washing your hands too many times, but for the person, it's a very stressful situation. For example, the cushions are lying in a certain manner. So till she'll go and correct it, it'll just keep bothering her, and she'll not be able to focus on other things. So that's where, I mean, so just being finicky and then being very compulsive about it. So when you're compulsive, the stress is higher. So you end up investing a lot of time in following your compulsion. And in case of compulsive eating, you really can impact your health. And OCD can be helped very easily with many things. You can do so clinical psychotherapy, of course, help, which just takes slightly more longer sessions. But for some people, it suits very well. For some people, hypnotherapy can lead to very quick results. The way anxiety is helped, similarly, OCD
yeah,
can be helped very easily with just few sessions. And actually, the proof is in the pudding. Once you experience, if you're actually really suffering and it's a huge thing for you, um, I think just by doing hypnotherapy and relaxation techniques, by each session onwards, they just begin to feel the change.
right. So one of the most commonly asked questions that everyone has been asking, a lot of people have asked us, is do you think that mental health is genetically engineered or do circumstances lead to mental health?
So, genetics definitely play a role. Psychosis, neurosis. I mean, if you've had family history, that definitely makes you more likely to have something. Similarly, is for substance abuse. For example, let's say the craving for like alcoholism.
Yeah,
So, I mean, if you're genetically, so it's like, everybody can have alcohol, but just people who are genetically predisposed
yeah,
will become alcoholics. I mean, if they've already had a history of alcoholic father, alcoholic mother. So it definitely, a lot of things run in the genes as well. And plus some things are just environmental as well. It's about peers, like wrong company, or just feeling some dysfunction at home and just seeking relief. So those things are much easier to treat actually, and the genetically ones are like harder to treat.
Yeah.
That takes longer, but that also definitely becomes better. Even
Oh,
the genetic, yeah.
yeah, that's good to know. And do you think that the pandemic gives rise to what may be termed as over-imagination in some people?
Yeah, absolutely. I mean, so all this could be very related: germophobia, hypochondria, and because see again, the same thing is like having access to correct information and making sure, because becoming aware. The more aware you are, and the more there are a lot of grounding techniques which I recommend. If you feel anything is swaying you or making you ungrounded, see, over imagining is being ungrounded.
Yeah.
Yeah. So grounding techniques like putting your, if anything is really becoming like stressing you at that point, even over imagination, and you are aware that you're over imagining, or you can just like put your feet on the ground. That's grounding. You can walk bare feet on the grass. You could engage all your senses, like listen to a song, engage your hearing, look at a color, engage your eyes, feel something cold or hot, that engages your sense, and taste something sweet or whatever, cold or hot or something. So engage all your senses, and that's a very grounding experience. So whether you're over imagining, you're feeling very panic attacks, you're feeling germophobia, hypochondria when you're imagining diseases. So all these things can be helped by simple grounding techniques. And I mean, at least that's immediate help till you can actually get real help and book your sessions and go ahead and actually get professional help.
Right. Right.
So
So,
definitely if the impact is huge and it's making you dysfunctional, definitely get help.
of course. So, Doctor, the theme for this year's Mental Health Day is mental health for all. How do you think that this can be achieved?
Um, I think, in terms of, GDP, in terms of government pitching in with that, mental health for all. There are so many underprivileged children, underprivileged families where a lot of abuse is happening, and, setting up NGOs. And I think, Ananya, you're doing a wonderful job. Like, you're setting up a talk session like this. So, I mean, people who don't have access or the means, money, finances, or even support at home to get help. I mean, if the wider and wider the platform is, and fortunately, a lot of things are coming up right now. So I think everybody is talking about it, and the awareness is always the first step to helping. So mental
Yeah,
health for all, I think the first step would be multiple platforms that people talk.
of course.
And so I also have a clinic, like, I encourage like, all free question and answers on Thursdays and things like that. And we also do sometimes like, free workshop. I'm associated with an NGO called Mil Bantke, and I offer like 2 free sessions for like, underprivileged children. So many people are doing such things, and, we all are doing our bit, I guess.
Yeah. So I think I agree that the first step to destigmatizing anything has to be to talk about it, because until there's a conversation, you can't do anything. So do you think that the new generation has more mental health issues compared to earlier, or are they just more open to talk about it?
I think they're more open to talk about it. They're more because they're more aware individuals. I mean, they can at least go online and figure out and validate their thinking and whatever they're dealing with, and they feel like more comfortable that, oh, I have this and I can get help. And because there are many forums, and just being, they're generally more aware. So earlier, the older generation, let's say like our parents and stuff like that. Um,
Yeah.
so if I'm like in my 40s, so my parents who are like in their 70s and 80s, I remember like if we had anything at all, it was just brushed aside that that you're imagining it,
Right, right.
or they would just say get off it. So now I think the parents are also more educated, and definitely way more open than our parents were. And
Yeah,
the change is really coming about where people are not scared to address and admit and go out and talk about it, because, and I think that's really leading to change. More and more people are coming out with it. They are actually helping people who are extremely shy to address their issues. So by being open and being reaching out, you're not only helping yourself, you're actually setting up an example for others and actually maybe impacting and inspiring many others to get help.
Yeah. So
So I think
many
we are just
people.
more open. It's not that they didn't exist. Everything existed, I believe.
Yeah, I agree. That's perfectly said, honestly. But many people say that social media and things like that lead to depression. Do you think that that's true?
So definitely the youngsters today have this bigger challenge. Social media is something that we didn't deal with when we were growing up. So alongside studies which are very demanding, social media is so huge, and the appearance and how the image on social media is so important. Like, anything that's like, for example, said on Snapchat can like send you in a stressful tizzy and things like that. So I think this is an additional challenge for youngsters on today, which is really making them vulnerable. So this huge platform is available, and we all have less information and less knowledge really how to deal with all that's available, because that can be very consuming.
Yeah. Thank you, doctor. And what tips
So
can you
social
give these
media situation is
youngsters?
really adding to the stress.
Right. What tips would you like to give to these?
Definitely social media detox. Definitely social media
Yeah.
detox. Whatever I'm dealing with teenagers, I feel they just need to, like, limit their hours, self discipline themselves,
Right.
and basically as soon as they feel that they're getting very impacted by, like, what somebody they're seeing writing on Snapchat, and like, that makes them dysfunctional with studies and things like that. So definitely detox days, like I advise, like, detox hours, like just limit your hours really. Because I mean, would you agree with me, Ananya? I feel that, social media, once you go on, it can suck in so much of precious time.
Yeah, I agree. It's
And
100% addictive.
these are very formative, very important years which will lay the foundation of, like, future education and things like that.
Yeah. No, it's definitely very
And
addictive.
if it
Like,
becomes a compulsion, if it becomes compulsion, and you cannot help, see, but if you can't help yourself, then just get help.
yeah.
That's what I
Yeah.
advise.
Yeah, because like say you go into Instagram and you see one post and then there's just like endless related posts that will keep showing up on your feed. There's never an end to that, and it's very easy to get sucked into that rabbit hole.
Mm,
So I think what you said like perfectly sums it up. If
absolutely.
you can't do it yourself, then get help from someone else to do it. Yeah. So doctor, this is a really
Absolutely, because
interesting
otherwise this can just
question.
take over your life.
Are our dreams really a projection of our unconscious desires?
So, dreams are basically various types. Dream interpretations is like very now like being studied more and more widely. Uh, what I know is that, my knowledge says that its subconscious mind is basically venting. So all the information, so whatever we don't deal with, keeps on getting fed in the subconscious mind, and subconscious mind tries to resolve and make sense of it. And in a way, it's some kind of venting that's happening. Sometimes two, three topics might just get intermingled and just appear together. They may or may not be together. So I would say that dreams are not really reliable to really base anything on it. But it's an interesting subject to study, and very intriguing. And of course, I mean, like, for example, test anxiety is a very common dream, that you just imagine that you have an exam.
Yeah.
So you just imagine that this exam is like an impending doom, and you imagine that there is no exam the next day, but you dream that, that there is an exam, and you're very stressed about it. So basically, your subconscious mind is basically trying to develop a stress mechanism towards exams and things like that. So
Right.
most of the time, whatever the dreams are, it's like I believe it's a venting mechanism, according to my knowledge. Whatever we're not dealing with, and it's getting like, stacked up in subconscious mind, and subconscious mind is just trying to make some cognitive sense out of it, and just organize some information, and just do away with whatever needs to be done away with. It's your mind's not natural coping mechanism.
Thank you, doctor. So Dr. Faizan wants to know that what exactly is schizophrenia and how do you treat schizophrenia?
Okay, schizophrenia is one of those more serious disorders where, if once initially it could be mild, and if it's in very severe stage, it can be very stressful situation for the entire family to manage. The person is hallucinating. They're always distrusting. Sometimes family members, sometimes close people. They have like all kind of very exaggerated imaginary fears and phobias that the whole world is like, conniving against them or strategizing against them, and they can feel very insecure and very stressed and really lash out. They can get aggressive. So the caregivers really, it's a huge challenge for the caregivers. Very, very severe form, they maybe have to be kept under some facilities and around professional help. And schizophrenia can be managed with medicines. Many forms of schizophrenia can be treated with medication, or at least brought down to a level where it can be managed.
Yeah.
But schizophrenia is one of the things where hypnotherapy is not recommended at all.
Right. And why is that?
So we mostly deal with more neurosis kind of thing, which is like more mental stress and emotional distress kind of situation. Hypnotherapy works beautifully, but psychosis is something else.
Yeah.
Psychosis is central nervous system disorders, which will require medication. And so hypnotherapy works fabulously for people who have who can basically focus. Anybody who has trouble focusing and trusting and in and out, or are into substance abuse, hypnotherapy has limited application for substance abuse and schizophrenia.
Right. And doctor, how does one know if you need to go to a counselor or if talking to a friend or family member is enough for you? Like, when is it too serious for your peers to handle it?
Okay. So I would say that, rate what is the impact, like on a scale of 10. Just give it like a vague number. So if it's like you say, my fear is, let's say, 3 on 10. So it's it's an area where self-help books, you reading yourself, and you reaching out to people, and maybe just finding one supportive friend or a supportive space where that person you can call when you're dealing with something, that can take care of it. But if you think, if the person says that the impact on my life is really bad, it's not just 10 on 10, it's 11 on 10. I have people who come to me and say, this is really getting to me, it's 100 on 10, and I really need to end it right now. It's totally sabotaging my life, it's making me so dysfunctional, it's really impacting the quality of my life. Then I think if it's not helping, speaking with friends, it's still bothering you, it's still consuming a lot of your energy and time and everything, and making you impacting the quality of your life in many other areas, and just definitely go for it. Take help.
Thank you, doctor.
Professional help, I mean.
Yeah. So, doctor, how would you choose if you should go for regular counseling or medication or hypnotherapy?
So I definitely feel everything else should be tried first before medications, because these medications would definitely act on central nervous system. In youngsters, can impact their reproductive health and ability to focus in school and things like that. I mean, so I would say that, try everything else first. Hypnotherapy is so safe. It's like no medicines at all. It's basically just talking. And so is EFT, so is CBT, clinical psychotherapy. There are many other modalities. I think everything else should be tried first before we go in for medication.
Right. Thank you, doctor.
Some of the medication can be habit forming. Yeah.
Right. Yeah, of course. We don't want to get into addictions. So, doctor, do you think that children today will see this period as before COVID and after COVID, thus making a clear distinction in their minds?
Just say that again, please.
Do you think the children today will see this period as before COVID and after COVID, making there a clear distinction in their minds?
Absolutely. I think the perspective, I mean, I'm just going to repeat the question to make sure that I got it all right. You're saying that, the COVID and pre-COVID, it's going to be different for us, right?
Yeah.
Yeah, absolutely. I mean, I think it'll take us a while to get back to normal. The fear lurks, the COVID. I mean, in 80% of the people, the COVID is just going to be like, just like a common flu and everything. But the elderly can fall really sick. So the elderly generation can be wiped out. So even when we're youngsters, I think the responsibility is on us. And I think it's time to learn that our conduct impacts others as well. So in a way, we all need to come together and fight it together. So I think some kind of unity needs to come about. And it's a huge learning experience for all of us. So if you're not wearing a mask, for example, you're not just being irresponsible towards yourself, you're being irresponsible towards others.
Right.
So many things have changed, right? I mean, contact, I think we always hugging and touching and everything is such a good thing otherwise. And we just have to hold back. I'm sure that'll have an impact.
Right.
in like, how we show affection and things like that. Yeah.
Yeah.
So I think things are really, it's really different. It's already become different and it'll stay different for a while.
Yeah. Thank you. So, Dr.
So more and more
Avantika,
need to
yeah,
work on mental health is required just to deal with this new situation.
right. Yeah.
Mental well-being is really required to be able to deal with such situation, like, more wholesomeness, more communication, more openness, more support for everybody, for each other.
Yeah. So, Doctor, we actually spoke about this in our interview, but someone wants to know that do you think that more people are coming to therapy because of COVID or because of underlying issues that just came out in COVID?
I think COVID has just become a platform for them to reach out. Maybe the crisis, like you were talking about it, like, if you're just like, you have abuse at home and you're cooped up at home, so everything will come up, like, like come
Right.
over the surface. But the underlying issues, I believe, are always there.
Yeah. Yeah, that makes sense. I
But COVID
think.
is definitely exaggerating everything and is really having a worse, like, it's making it worse. The mental well-being and emotional well-being, it's like, really making it more complicated.
Yeah, I agree. I mean, now we're forced to be alone with our thoughts, so there's no chance to escape it.
Absolutely.
So, Dr.
But
Avantika
in a way,
wants
it's
to.
good also, like, it's going to get addressed.
Yeah.
Sure.
So, Avantika has a question, which is that have you ever seen malnourished patients, like, with issues with nourishment, basically, in your clinic?
Malnourished, though it's not really in the scope of our conversation today, but I have seen definitely malnourished. You mean to say anorexic? Does she mean anorexic?
No, I asked,
Or
not
malnourished
eating
because of their
disorders.
financial situation?
Malnourished because of their situation, not because of eating disorders.
Financial situation?
Yeah, yeah,
Sorry?
yeah, financial situation.
So that's not really in scope of my work. That's but so I mean, I didn't really understand it very well. So have I seen malnourished patients
Yeah,
as my patients?
yeah, that was the question. Like for
Because of
hypnotherapy.
financial situations, hypnotherapy, no, I'm
Okay.
afraid not. No.
And Doctor, now about eating disorders, do you think that more eating disorders are arising in this generation because of the pressure to look good on social media?
So I think definitely more and more screen time, less and less play time. We having a virtual community and not having real peers doing real activities outside. Uh, I think would definitely lead to eating imbalances. And so, I mean, it's like a double-edged sword. Eating too much or eating too less, both are like serious issues and has serious health impacts.
Yeah, yeah,
Anorexia, bulimia, I mean, weight gain, I mean, like obesity, heart disorders in younger patients. So, and which can be very easily corrected with hypnotherapy. It's such a useful tool. It can really help you, for a person who's overeating, we can really help with cravings.
yeah.
For people who are like have poor self-image and are being anorexic and eating a lot less, just because they're coping up with looking good all the time. It's such a stressful thing. And we don't even realize the kind of long-term health impacts that we'll have because of like, imbalanced diets.
Right. So, how would you advise these people to improve their self-image? Because there's so many unrealistic expectations in television, social media, magazines, all around us.
So my favorite phrase is that self-love phrase that I'm whole and complete within myself. I approve
Right.
of myself. I love myself.
Right.
So these are the simplest things that you could do at home without like a therapist or anything like that. That just give yourself a lot of love, a lot of approval, and eventually educate yourself that there's so many qualities in each person. There is always something really nice, and figure out your qualities and hone them and believe in them. And surround yourself with people who believe in, like, rather than stick to peers who are like, derogatory about you. I think negative people are totally avoidable. People who criticize you, and build a community, build a support system, build a friend circle for yourself where people are similar and approving of each other and supportive of each other. Choose your friends wisely, I would say.
Yeah, yeah, that is very
That will
insightful.
help self-image drastically.
Right. But like a lot of times, especially in our age, there's a lot of toxic friendships and people don't really know how to get out of them. So how would you
Hmm.
advise like beginning to cut people out of your life what are the steps you should take?
So, Ananya, I believe that, intellectually, if we can help ourselves, we will not go into those situations. They feel helpless in those situations, toxic relationships, and the helplessness is coming from the subconscious mind. And that's exactly what I deal with.
Yeah.
Where you feel that you are aware that it's impacting you negatively, but you cannot let go of those toxic relationships. That's where we come in. I mean, just by your parents saying no, you will not listen to it. You're telling yourself you will not listen to yourself. Your friends are telling you it's bad for you, not listening to anyone. So something needs to change within. Something needs to change from a deeper layer, and we work on deeper layers of your mind when we work with hypnosis.
Right.
We improve your self-image, we increase your self-love, we help you build like a very positive image of yourself. We make you believe that you don't deserve that toxicity, you deserve much better, much more.
Yeah.
Firstly, be kind to yourself and not expose yourself to toxic people. They can really drain you.
Of course, yeah. So basically, self-love is pretty much the answer to most issues, I think. And I think people in our generation have way too less of that, and we do need to work more on that. But it's amazing to know that we have options like, hypnotherapy and talking to people
So
to
social media, all the advertisement is not helping us. It's
right,
leading to poor self-image. They are
agree.
trying to tell you, if you're not looking like this, you're not good enough.
Yeah, you're not
If you're
perfect.
not behaving like this, you're not cool enough.
Yeah,
If you're
yeah,
not drinking Coke, you're not cool enough.
yeah, exactly. So it's good to know that there's still hope,
Be
though, that
very,
we
very
have
watchful of
options.
what you're watching.
Yeah. I think it is a very toxic space in this day. So doctor, how do disorders like dissociative amnesia arise about?
Disorders like dissociative amnesia. So that's a very professional kind of term. Is it like a question from somebody specific?
Uh, this person is studying psychology in school.
Okay. So dissociative amnesia is basically your way of basically protecting yourself. You are blocking out something which is unpleasant for you. Your mind is blocking out, dissociating, and not remembering something because it was just too painful to handle or deal with.
Right. Okay. Thank you,
And
doctor.
so if it is not impacting your anything major in your life, I mean, then of course it won't come up. But if you think that's actually leading to some other thing, by dissociating with that, like denying a part of, like, sometimes people just go numb and things like that, or numb out or wipe out or clean out stuff. If so, I think it will manifest in some other form later, and when you're much older. So I mean, actually it can be dealt with very easily
Right. Okay. That is good
if
to know.
there's any impact is realized.
That is good to know. And doctor, we have time for one last question. The rest of them I will send to you afterwards. So, what do you recommend
Sure.
everyone should do for good mental health? Like, what are some things that people can do every day to make themselves feel good?
So I've already said, so self-love is my biggest mantra. I mean, when you start loving and approving of yourself, you're not vulnerable anymore to what people are saying. You don't slip and sway into once you and so okay. One of the other things that I really believe, like, functional harmonious family. So even if let's say the older generation is not aware, if we make ourselves aware that to have healthy boundaries with friends, to have healthy boundaries within families, a healthy family or healthy friends group would be like, there's more I-ness.
Yeah,
I am like this and you are like that, and we both are okay. So
right.
that kind of, like, things can be learned and practiced with your friends who are people. Don't be very judgmental of others. Don't let others be too judgmental of you. So healthy boundaries, healthy communication, not running away from conflict, always going back for effective communication. I believe that, making peace with parents is very important. One of my favorite phrases is, if you make peace with your mother, you feel grounded, you develop roots. And if you make peace with your father, you can really touch the sky, like reach out, explore your full potential, your full talent. So I encourage like really harmony at home with parents, sibling, whatever needs resolving, resolve on your own. If you cannot resolve on your own, get help. So like, healthy relationships, like, there should be no toxicity, conflict, not avoiding of conflict, and like not, again, if brushing issues under the carpet. So always
Right.
addressing, always address, like, living powerfully in a balanced manner.
Yeah, yeah, that's
And
quite
there's so
beautiful.
many things available right now. I mean, yeah.
That's quite beautiful,
And of
especially.
course, develop your passions, develop what you love.
Yeah, of course. So, Doctor, we'll stop here for today. I will send you the rest of the questions. And thank you to everyone for tuning
Great.
in and joining us. And of course, I would like to say,
Ananya, I hope that was useful.
yes, Doctor, it was very useful. It was amazing, honestly. Thank you
Great.
so much for
Good to
your
know.
time.
Good to
And
know. Thank you. Thank you, Ananya.
and thank you, everyone. And please remember what Dr. and I spoke about in the beginning of this. The only way to truly eradicate the stigma around mental health is to actually talk about it. So if you see that someone is going through something, or if you yourself are going through something, do not be afraid to reach out. I will add some helplines at the end of the video, which I'll be uploading to YouTube. And thank you so much. And yeah, and of course, as Doctor said, the message of self-love is the most important message that there is. So thank you, everyone. I'll end the meeting now. Thank you, Doctor.
Thank you. Thank you, Ananya. Bye.